Welcome to Toronto Public Health. We've been a vital part of our community since 1883. Back then, we helped improve unsanitary living and working conditions to prevent diseases like typhus and diphtheria from becoming a serious health threat. Many of the things we take for granted today, safe water, sewer systems, and vaccinations, had their start through the efforts of Toronto Public Health. That effort continues today and spreads across a now vast city with a large and diverse population. And Toronto Public Health is helping everywhere, from pregnant women and new mothers, families, babies and young children, through to teenagers, adults, and the elderly. A few examples. We help people learn about the benefits of a healthy diet. New moms learn how to breastfeed successfully. Parents learn how to ensure their children grow up healthy. And teens learn how to party safely. We work with elderly people to help them prevent falls. This video is an introduction to our role in the community.
My work is community mobilization and community development. In my interactions with different community people, they're excited to work with Toronto Public Health. When we come to the table, people know that things are going to get done, that we're bringing a certain commitment and level of professionalism.
Good morning, Toronto Health Connection. Pam speaking. How can I help you?
Toronto Public Health works with individuals, groups, and the population as a whole. We help develop public health policy, and we're strong advocates on behalf of the people of Toronto. And we believe in public education. For example, Toronto Public Health was instrumental in bringing forward the pesticide bylaw and a comprehensive no-smoking bylaw that was eventually adopted across Ontario. These bylaws required extensive public education. For the smoking bylaw, we work with restaurant and store owners to inform them of the bylaw. We help people quit smoking at cessation clinics, and we educate young people on the risks of starting to smoke. Reducing the spread of infectious diseases, including sexually transmitted infections, is another important part of our work. For example, we work closely with community and healthcare facilities to control the spread of TB. We track and monitor diseases, respond to outbreaks, work with schools to make sure children are up to date with vaccinations. At our clinics, teens discuss and learn about sexual health issues. As diseases can now move rapidly between countries, public health organizations everywhere continually track and assess potential threats, allowing organizations like ours to respond to emergencies as soon as they occur. The SARS outbreak and the threat of pandemic flu, the spread of the West Nile virus, have made clear the importance of emergency planning and preparedness. Toronto Public Health plays a leadership role in emergency preparedness for the City of Toronto. Toronto has thousands of restaurants offering food from every part of the world. Our health inspectors help ensure the food they serve is safe to eat through a rigorous inspection program. You've probably seen the Dine Safe signs. They're a visible reminder of our work to make and keep Toronto a healthy city. The Dine Safe program has been adopted by many other cities. Toronto is one of the most culturally diverse cities in the world. Half of the city's residents were born outside of Canada, and each year more than 60,000 newcomers make Toronto their home. To respond to such diverse health needs, our staff provide culturally appropriate services in many languages. Unfortunately, many people find it a struggle to feed themselves and their families. Working with community partners, Toronto Public Health helps individuals and groups get easier access to nutritious, affordable, and familiar foods. We also promote alternatives to food banks with community gardens and community kitchens. We help teach parents about food preparation for their children and advocate for healthy food policies. We work with others to make sure school kids get healthy foods.
We delivered nutrition workshop in the city of Toronto that is a diverse city, so you have people from diverse located in the world where they can get nutrition food, where they can get your cultural food, doesn't matter where they are from, and also how they can get good food for raise your kids' health.
Dental staff help low-income seniors and children get the care they need through public health clinics, community partners, and long-term care facilities across the city. Toronto Public Health plays a key role in advocating for access to dental services for adults who cannot afford dental care. Toronto Public Health's mission is to improve the health of the whole population and to reduce health inequalities. This means that addressing the needs of Toronto's vulnerable populations goes hand in hand with improving the health of the population. But the gap between Toronto's wealthy and poor is growing, and this challenges the health and well-being of the city as a whole. Far too many people still live with chronic illness or die early from diseases and injuries that can be prevented. Toronto Public Health and our partners play a vital role in promoting health for all and reducing inequalities. Toronto Public Health is accountable to the Board of Health for the delivery of programs and services, as well as to City Council for administration and budget approval. The board generally meets monthly, and all meetings are open to the public.
Broadly speaking, the committee has laid out a very positive agenda.
The Board of Health promotes healthy public policy and makes sure that health issues get the attention they deserve. The costs for most public health programs are shared between the city and the province.
At Public Health, we also know that to be born healthy and stay healthy, you need a clean environment. We're really proud of the work that we've done on smog and climate change, on pesticide reduction, and environments for kids, because it's really making a difference, we hope, for Torontonians. Public health is a unique environment in that you see the impacts directly every day and then you get to do something about them. What's nice about our work on the environment is that everyone reminds us every day of the stuff that we should be doing to protect our health, and we get to do that every day, which is really nice, and we see results short-term as well as long-term, which has been really satisfying for my work at Public Health.
Toronto Public Health is a diverse group of highly skilled, experienced individuals. We're committed to expanding our knowledge and skills. We're proud of the work we do to improve Toronto's health.